policy important to address health equity, and how can public-private partnerships advocate for this issue regarding policy?
First of all, one of the fastest ways to drive change is by passing laws where it's unavoidable and there's no questioning whether or not you should do it. So policy is always going to play a part, right, whether it be local, state, or federal. In neighborhoods where equity is an issue, you also have transportation issues. You also have family income issues. You have per pupil funding issues. You have affordable housing issues. And all of those things work together. They're called structural issues. And the AHA, as an example, wrote a paper on structural racism and how it looks at policies and systems and social norms. And for those that are counting, I didn't say individuals. I said policies, systems, and social norms that often work together to disenfranchise those of lower income, lower education, and most often race and or sexual orientation. So when I think about the power of policy, there are examples that work, but we're not going deep enough and we're not going wide enough. And this spirit of companies working together in communities is a really fast way to do that.
This question, I love the framing of it because it's kind of called a magic wand, right? We're here to talk about health equity. What would you like to see the forum doing or executing that takes our impact to the next level? Magic wand for Gerald.
I also think there's an opportunity to rethink what we're spending money on. And there's this notion of symptoms versus root causes. And then I'll tell you what I mean. So when we get headaches, we have a tendency to take an aspirin. But what we're not really dealing with is what is our body trying to tell us and giving us the headache in the first place. So squeaky wheels, get the oil, all that wonderful stuff. I'd like to see us really start thinking about root causes of why we're offering people meals, root causes of why we're subsidizing the fact that housing needs to be subsidized, or the fact that there's millions of people who actually have care, but they can't afford their copays. So root cause back to capital, access to capital, living wages, and the ability to afford a life that shouldn't matter based on the zip code that you live in, one magic wand. And then the other is partnership, right? This thing is too deep and too wide for one organization to think that we can do it ourselves. What we can do together, let's do it and be intentional about it, even if it means each of us get less, but we'll be able to do more.